Hi, this is Jonathan James with Hope Charities, and I want to welcome you to the Hope Podcast. It's great to see you today. Thank you so much for tuning in, and we want to say a big thank you to our episode sponsor, Kedrion Biopharma, who has supported this podcast and several other issues. We're super excited about the content that we're able to bring to you, and we appreciate their sponsorship. You know, today has been a really special opportunity because I get to introduce to you a real friend and person in the community that I think you're going to love to get to know, as I have Maxwell Hunter. Maxwell, it's great to see you today. Thank you so much for joining me on the Hope Podcast.
Thank you for having me. I appreciate it, Jonathan.
Well, it's really just a joy for me to be able to have this opportunity to interview you today because you are a very, very special person in my view. You have a lot that you've done in your career, but especially the behind-the-scenes support of our community in the bleeding disorder space. You are part of the lifeblood, pun intended, that has really helped sustain our community because you are really in charge of quality assurance for blood collection and plasma collection. And I'm excited to get to know that a little bit more. But your title officially is that you're the Director of Quality Assurance right there out of Atlanta, Georgia.
That's correct.
And tell me a little bit more about what you do at the company and what your background is.
Thanks. Well, as you said, I'm the Director of Quality for KED Plasma, which is a part of the Kedrion ecosystem. I have been in quality assurance and in regulated industry since 2002. That includes food, pharmaceutical, as well as biologics, so blood and plasma.
Wow, that's incredible. You know, there's so much that goes into the collection of plasma. And, in the beginning stages, especially for people just tuning in and might not know a lot about hemophilia and other blood disorders, one of the things we really were dependent originally on the collection of blood in order to be able to provide the products that we needed to survive for factor replacement therapies and so on. And the industry changed a lot and came into recombinant products, and there was other things that were available at some point, really as a response to some things that had happened in the industry, which we'll get into a little bit. But I wanted to really highlight the fact that there's still a huge need for blood collection. One of the things that I'm always fascinated about, I think about this as it relates to advocacy especially, is that our community had a huge impact really on blood safety as a whole by putting some standards in place with CDC, FDA, others that really was driving force trying to establish some safety things. But that baton was really handed off in a way that has gone so far beyond where some of us remember it from back in the 80s. Yes. And so, I'm excited to dive into some of these details and everything. But tell me a little bit about just your professional journey and what kind of got you passionate about what you do today and what your day-to-day rhythms look like. Tell me a little bit about just your journey as you came into your career and what it is that you're really passionate about with what you do today.
Yeah, so I graduated with a biology degree, pre-med. The main thing that I looked for in a career was really the opportunity to be able to help out and to help people. When I first began in the quality career, I started to understand the impact that we had, not just with the organization itself, so doing things that help to ensure our products are safe, but also understanding the real impact that we had on people downstream. When I was in pharmaceutical, that downstream impact was people that would take medications. Now it's more focused on the patient. We're developing medications and products and therapies that are helping real people day to day. So for me, that's the thing that drew me in to this career path, and it's the thing that keeps me here in this career path.
That's so good. You know, I didn't realize that this is not something that most people just go to school to do. This is something that you kind of, like a lot of really important professions. It's who you know. It's not always what you know, but a lot of times we can look back and it's 2020, right? Yeah. You can see behind you and go, oh, this makes perfect sense. Yeah. But now you oversee, I think it's over 30 centers that you actually oversee, and there's lots of moving parts and lots of intricacies, and you're dealing with quality from the standpoint of not only helping make certain that all of the operational things go along, but you're also looking at the infinite, really mechanisms of technology and how that, the screening processes go and things like that. And so, blood collection centers, we see them sometimes just, as we're out and about in our communities. You have blood collection centers really all over, right?
We do. That's correct. We now have almost doubled in size, which seems like overnight. We're at about 60 donor centers now. And you're right, we have a lot of sites all across the nation. With those collection facilities and really with the industry in general, one of the things that's been a huge change over the years is the amount of regulation, the amount of quality that's put into the process and put into the thought behind the process. Mm-hmm. You mentioned the kind of 1980s, and one of the things that occurred at that time was the HIV crisis. Mm-hmm. So I know that sticks out. There was that was the first time that it was being recognized that there were these blood-borne viruses that could have such an impact downstream. And so it was somewhat of a watershed moment for the industry, and that prompted a lot of change in the industry. Changes that we still, to this day, are pushing forward and continuing to improve. One of the main things that changed was screening processes. Mm-hmm. From that time to now, we have a far more robust screening process that's in place. It includes everything from questionnaires of the donor to better understand their history, the people that we're collecting the product from, to testing that we do on those donors. It's just very encompassing.
Wow. So you go pretty far into that. I mean, the technology itself, I know we've talked some about how the technology is very advanced in itself, but I'd like to maybe work backwards a little bit if we could and start with the technology, because once you've collected it, there's obviously the questionnaires on the front end, which we'll get to in a minute, but I mean, on the back end, you can detect a lot of times now whether obviously there's any kind of problems within the plasma that you've collected, but you can actually even see like second and third generation exposure, like if they're high risk for anything as well. Is that correct?
That's correct. Yeah, there's a lot of things that we do on the back end. So on the testing side of things, it's kind of a layer of safety mechanisms that we have in place. So on the end where the product is actually manufactured, there's testing that's performed on that level. It's looking for these different pathogens that could potentially be present. There's also, they have a testing process as well to identify if there's any potential pathogens in that product. In addition to that, there are advances in the manufacturing process that help to remove or inactivate potential pathogens that are there. These are different things, whether it's filtrations. You have physical processes where you have physical removal of pathogens. You have heat treatments that can be performed. Just a lot of different ways to reduce that pathogen load.
Wow. It's really incredible, the level of intricacy, but you can even see if there's somebody that is, that possibly had been at risk for being exposed to something as well, right? It's not just actually what's present, but sometimes it's actually what potentially could be present. Is that right?
Yes, that's absolutely true. So tying that into kind of the screening process, one of the things that we do is when donors come in, we question those donors. We capture these questions electronically. So we're able to see for every donor that comes into our system, what's their history? What type of things have they participated in that could potentially be high risk? And based on those things, we're able to make a determination of whether they're suitable to donate products or not. And so we keep that history. We're able to track that history. If, let's say, hypothetically, someone was to donate product and we were to find out at a later point that they were potentially exposed to something, to a pathogen or to a virus, or participated in a high-risk activity, we're able to trace that back real time, and we're able to notify anyone who would have received products from that donor. That's another one of those kind of technological advancements that's occurred since the time in the 80s.
That's incredible. Tell me a little bit more about, just the last few years has been rocky for everybody. And so COVID has been a huge problem that we've all been concerned about. And I'm certain that really hit your area in a big way. So tell me, how was that for you, just going through that? And then, of course, there's obviously all the operational side of it. Tell me, how did COVID really impact the work that you're doing?
Wow. So, COVID was a very trying time.
Yeah.
We had to adapt, and we had to adapt fast. One of the things about this industry, and kind of the passion behind it, just because we have this pandemic that's going on, doesn't reduce the need for the patients that are receiving this. And so we had to find a way to continue operating, but to continue operating in a safe way, not just for the donors and for the patients, but also for the staff members as well. So we really had to kind of reinvent the way that we conducted business, even from a quality standpoint, to ensure that we were able to do that and do it in a safe way. We implemented a lot of things like additional screening measures on the donors that came into our sites. So be that temperature checks, be that additional questions that we implemented to screen those donors. But we took a lot of actions to try preempt the screening of those donors that were donating with us.
One of the things that I find fascinating is that there's, you have all of these collection centers, but there's still such a huge need for plasma in so many different ways, whether it be for advancement of new products or for the placement of current therapies. Tell me, what is the demand versus supply like for you right now? Is there enough supply? Do you need more supply than you have currently?
We need more. For me, from my experience, that's been an industry trend since I joined the industry in 2007.
Wow.
It's been a increased need for plasma products. So we're only seeing that. I couldn't quantify it for you, so I can't give you specific numbers, but I know that the demand is tremendous.
Very high, yeah. I think that it's striking, because I have to say that as a person living with a bleeding disorder myself, I feel like that it used to take thousands of people to donate blood for me to be able to have even one treatment, and so that has felt like a burden in some ways of, and many people in the hemophilia community, most of the support network that we had with chapter organizations and other national groups and stuff were really founded off of doing blood drives.
Yeah.
So tell me a little bit about, how does that coalesce with what you're doing every day in terms of blood drives? Sometimes we see these blood drive, trucks out in front of Walmart or somewhere else. It's like, tell me, how does that coalesce with what you're doing every day?
Yeah, so it's part of the industry as a whole. So you have blood donation, and then you have source plasma donation. For us, we're not so much conducting blood drives out in the industry, but we have standalone facilities that are all throughout the U.S. And so you're able to actually schedule a time to be able to come in and to donate plasma and kind of go through that screening process. One of the things that is really neat with plasma as opposed to blood donation, plasma, because we're removing the plasma from the blood, we're able to return those red blood cells to our donors, which means that they're able to donate more frequently. So one of the benefits that you get with plasma donation that you don't necessarily see with blood donation, all being helpful, but is that fact that you can donate 2 times a week as opposed to once every 56 days for blood.
Wow. That's neat. I think that there's sometimes for people who've maybe done this before, it makes sense. But if you haven't been, I have to say, for me, you go to a blood drive and they don't want what I have, so I get turned away a lot of times. But so that's not an experience that I've been commonly exposed to. But I have people, friends and family still, that ask regularly. Or actually, we just got a message last week. I guess it was Friday. Somebody said, my neighbor wants to donate plasma and not sure where to go or who to go to. And I'm thinking, I don't know either, But tell me, as far as like getting people to come in and the path of what that looks like, I hear things about people that say, well, I want to make certain that my friends or family are a high priority. If they need blood, that I can put their name down. Is that something that you deal with, or is that more on the blood collection side?
That's more on the blood collection side because of the method of delivery of the product. For the plasma side, it's more about collecting the plasma to then make medications at a manufacturing site.
Right.
And so some of the products that we make are like immunoglobulins. So for people who have immune deficiency or immune disorders. We also make clotting factors for people who have bleeding disorders. That's a common known one. Anti-D is a big product. So those who have risk for hemolytic disease, so where the mother and the child potentially have incompatible blood types. So that's an important one. Albumin is another. So plasma volume fillers, we call them. So if you have someone who maybe is a burn victim or need that or have a deficiency in their plasma volume, we make albumin for that. So those are some of the things that we're able to manufacture down the line. And that's actually one of the things that helps to decrease the risk within the plasma industry. Because it's going through that manufacturing process, we're able to, again, kind of remove any potential pathogens. But again, this is a process that's done on a product that's already been screened, product that's already been tested. And so you're kind of layering all of these safety mechanisms to ensure that the risk of a pathogen being present in that final product is extremely, extremely low.
Products such as Coate are derived from human plasma and adhere to strict safety protocols. In this video, we'll explain the manufacturing process for Coate. First, the plasma is collected. This is done at FDA-licensed donation centers with carefully screened healthy donors. Only plasma collected in the U.S. can be used to manufacture products available in the U.S. The next step is viral testing in two different ways. First is serology. Serology can detect markers that indicate whether a donor has been in contact with a virus that could be passed on to others. Next is NAT, or nucleic acid amplification testing. This is a very sensitive test that can detect very low levels of viruses in plasma. NAT is so sensitive it is like finding a needle in a haystack. Only plasma that is virus-free is used in manufacturing. Thousands of plasma donations are combined into a large pool, and then a second round of NAT testing is done. Fractionation is the next step. This separates all of the different proteins in the plasma until only the protein you want, in this case, factor VIII, can be collected. Finally, the collected factor VIII is treated with solvent and detergent, which is like a chemical wash. The solvent and detergent are removed. And then the factor VIII is treated with dry heat for 72 hours. These two steps work to inactivate or eliminate any viruses that may remain. There have been 0 documented cases of viral transmission associated with Coate's current manufacturing process. It's important to keep in mind that because Coate is made from human blood, it carries a risk of transmitting infectious agents, such as viruses, the agent of the variant Creutzfeldt-Jakob disease, or unknown infectious agents. Kedrion is a proud manufacturer of plasma-derived products that keep life flowing. We want to thank all of our donors for their gift of life-saving plasma.
You probably can't say this for regulatory reasons, but I'll say it's probably next to zero. I mean, it's so close to zero that it's next to zero. Yes. I think one of the things that's really concerning is, and again, for our community, so many people have fear of what once happened reoccurring. But quite frankly, there's been also a whole lot of study that's been presented to our community through the SIPET study and others that would actually show that there's some real advantages to people using plasma-derived products. Yes. And it is a lot more natural. It's a lot more whole. And so those things are important because your body can recognize these things as human, and it doesn't fight against it as often. And so that's been studied quite a bit.
Yes.
It's quite interesting to see more information coming out about this. And so I think that there has been a resurgence of people going, man, maybe I should reevaluate this again in my treatment plan, because, and maybe it's not the whole, maybe it's a piece, or maybe it is the whole. Maybe it's the first, 50 exposure dates, and I need to be making certain that I'm using the most whole product, or whatever those things are. But those are things that I think people are evaluating once again. And this is one of the reasons why I wanted to spend some time on, and I really appreciate you divulging so much about the safety as and a role that's played here, because I do think it is a concern that comes up for people, especially in our community, is that do those risks still exist? And I think it's a resounding no.
Yes.
I think that's very, evident that those same risks that we once upon a time experienced were not there.
Yeah.
One of the things that I do hear sometimes people say, and I know we're spending a lot of time on some of the downsides, but it's important, I think, in the conversation for people to understand how thorough these processes are, is that, some people, might say, well, gosh, isn't it just a bunch of people who are going twice a week to get, a little extra cash in their hand, or they're just kind of, maybe they're on drugs, or they're on something else, and I think that there's, you've given me some statistics before that kind of made me believe that maybe that's not 100% of the people that are coming to those, and you have a way to weed those people out too, right?
Absolutely, it is a stereotype that's existed, and I think that comes from a lot of the things that occurred in the faraway history. I can tell you about my experience. I've spent a lot of time in plasma donation centers and a lot of time in this industry. What I've seen is that the donors we receive have a genuine, true passion to help. It's something that I can't quantify, but just through engaging with donors, I would say that 3 out of 10 of these donors have someone they know have received plasma products.
Wow.
And so they kind of understand that impact and how important it is to donate. And so those are the people that we're really seeing come into the donor centers to donate. Wow. In addition to that, as mentioned before, of course, we have safety measures. So we have screening process, we have testing that we're performing, we have the things in manufacturing that can help reduce any potential load of pathogen we may see. But ultimately, what I'm seeing is that the donors are there to help, and that they're passionate about donating to help people.
Mm-hmm. And a lot of times these are people that think like, man, I might not have money to donate to an organization like Hope Charities or something like that, but they look at that and they go, man, but I can go and donate blood.
Yes.
And that is a way to help. And so I think you said something about statistics. I don't know if this is accurate or not, but something around 30% or so have actually had somebody personally that they really felt like that they had received benefit from these collection centers, and so they wanted to give back in that way, and they could.
Yeah, absolutely. And that's just been my experience from being in the donor centers, interacting with our donors, and it's just been my observation that a lot of the donors that we have are really donating because they know someone who's received those products. We also see it with the people who work in this industry. A huge portion of the people that work in the plasma industry and in the blood industry are people who have had family members that have been impacted by these things, and they want to find a way to contribute to that process. So it's one of the things that is really unique to me that, from being in pharmaceutical industry and kind of switching more into the biologics and patient-driven side of things, it's been really unique, the employees and the people who choose to work in this industry. They're very passionate people.
That's so special. I know we see that on a regular basis about how people that really have been positively impacted, sometimes it's because they were negatively impacted. They want to either help out because they want to do more, or they want to help back because they want to change. Right. But either way, it's still a collective group of people that are really coming to really make positive impact and to fill that capacity with their lives. And it's just so heartwarming. And every time you get to see people that are doing that with a sense of passion that goes beyond just the mechanics of doing a job, they're not doing it for a paycheck alone. They're doing it because they're passionate about it.
Right.
And that is just a totally different outcome, really, when you have people that are driven by that purpose.
It is.
I see that in you. I know in a couple conversations we've had is that you have a real spirit of excellence, and it's obvious that what you're trying to do is to really provide just the most excellent platform possible when it comes to quality and operations, and it's really amazing to see some of the work that you've done.
Thank you very much. It's very humbling. Yeah, that's the main driver for me. I want to be able to do something that genuinely makes a difference, that keeps people safe, whether they're donating plasma for us or whether they're receiving product on the back end as a patient. To me, it's just really important to ensure that they're well taken care of and that I'm doing everything I can to contribute to the industry continuing to advance.
Yeah. That's so good. Tell me a little bit about, we've talked about some of the technology, we've talked about some of the operations, we've talked about some of the donors. Tell me a little bit about the regulatory environment. You've said this a few times, but, the regulatory side of it can be both really good and important.
Yes.
Sometimes it can also be a lot of red tape.
Yeah.
And so, sometimes you're really glad that those things are there for safety measures. Sometimes the things that were created with good intent don't always have the outcomes that people want them to. So we get into these, red tape things sometimes and go, well, does all this need to be there? Yeah. And so sometimes steps are skipped or steps are not observed. But in this space, I mean, I've been around some of these centers before and some of these collection agencies. It's like you really can't skip any of the steps, right?
You cannot. The thing about regulation is it exists for a reason.
Yeah.
And yes, I will say that it can be times when it's slow to change, but I actually think that's a strength and not a weakness. I think that when these regulations are put in place and for the quality systems that we put in place to ensure that we comply with these regulations, they're done with an intent. They're done with things in mind like the HIV crisis that was observed. And so when you put these steps in place and once you're able to prove that these steps are effective and efficient, where we are now, before making changes to those things, you want to be more slow moving and more with intent. You want to evaluate those things in full before making any changes to them. And so, yes, at times it can be a little frustrating because it is a little slow moving. But again, I truly think it's a necessity, and I think really it's kind of a testament to its effectiveness just in what we see now versus what used to exist within the industry.
That's so good. One of the things that I recognize is that, progress has to be made no matter what part of the industry you're in.
Yes.
And it's important that you really respect the foundations of what was, laid before us. I mean, we're all here because somebody else did some hard work before us, right? Yes. I'm alive today because somebody focused on that. Right. There is reasons why these things exist, and being able to respect that, I think, is it's an important responsibility that we have.
Yes.
And sometimes, we can get tired by those things from an operational standpoint. But I have to say, as a patient, I really appreciate the level of integrity that you maintain because those things really help to really, give us peace of mind and know that the products that we're taking are really not only going to be effective. We know that they're effective, but the question is that are they also safe? And
Absolutely.
You've answered that question over and over and over again every day of your life, and I appreciate all the hard work that you put into that. And
Absolutely.
And I can tell that there's a lot of detail that goes into that. I know that some of the things that you're doing too is in the area of understanding trends and looking at data, and there's so much that is kind of you're constantly reevaluating just gobs and gobs of data. I think about, we hear a lot of talk today in today's society about algorithms, and, we hear talk about, Google analyzing data and,
AI.
Apple this and AI and whatever, and there's, Elon Musk is in about every third conversation on the news about, what he's doing with SpaceX and whatever. So there's a lot of advancements that are happening, but that's happening right there in your backyard as well, where you're taking so much information in regularly just about the pathogens that you see, maybe new ones that are being developed and things that are going on. And so how has data management played a role in the outlook of what you see happening going forward in the future for what you do?
Oh, wow. That is an excellent question. It's a challenging one to answer because there are a lot of different aspects to it. But in general and kind of at a high level, we look at a lot of metrics. We look at a lot of data. Specifically for kind of my interest from a compliance standpoint and from a quality assurance standpoint, we use metrics to really drive continuous improvement. We do it to apply intentional pressure on ourselves to improve, to identify deficiency. And so the way we do that is we, of course, have process flows that we have in place. We have procedures and processes that are in place. These things are expected to go perfect each time. Mm-hmm. It's expected that you won't see deviating events. However, in a real world, deviating events occur. And so for us, we analyze these deviating events. We determine, why did this deviation occur? How did this deviation occur? How can we prevent this deviation from occurring in the future? Mm-hmm. And so what you almost create in looking at metrics against things like that is you almost create this self-healing process. That you have a process that's in place. You work through that process. When you see anomalies against that process, or when you see errors against that process, you're real time assessing what those things are. You're assessing, is there an impact based on that type of error? And then you're assessing, how can we ensure this thing never happens again? And so what you should see, if you're properly applying this, is you should never see things going in a trend of continuous increase of errors. You should, you should always see things being resolved, and you should see a lowering of the repeating of errors, or less repeating of errors.
It's incredible. Sometimes the fact that we collect a lot of data on different things is one thing, but what you do with that information is a whole different thing. And I have a high appreciation for what that looks like inside of a large organization like you're trying to manage, is that there's just so many moving parts and so many moving people, but it directly influences policies, it directly influences procedures, and those standard operating procedures really what matters. And it's interesting because it's not only feeds into the data science, but it also, for you, it also feeds into the biology, which is what I appreciate about your love for. I think you said at one point that you kind of wished you kind of wanted to go down the path of being a doctor at some point, and I can see that you really have a love for it in a way that might be boring to others, and but I love that about you. I think that's really excellent. That
there's another aspect too with the metrics that's really important, and it's kind of on topic for what we've been discussing, but viral marker rates. So going back to when it was kind of discovered, the link between blood-borne or blood products and blood-borne pathogens. One of the things that is in place in the plasma industry are very specific metrics that are tailored towards identifying how many instances occur in which we have a donor donating that we find that donor to be reactive for a pathogen. Of course, these are very minimal events that occur, but each time it occurs, we track that. And we track that not only as an organization, so as Kedrion, as Ked Plasma, we track that as an industry. And we compare ourselves as an industry to see if any specific locations, so any specific donor centers, are having an uptick in viral marker rates. And we use that information to change our processes and to, again, adapt our processes in real time to ensure that if we are seeing an increasing trend, we reduce that and that we mitigate any risk from that. So again, it's just it's another element of safety that we kind of put into the spider web, kind of this layering of quality that we have.
That's incredible. I wonder how that plays into your. Again, I kind of go back to COVID and the real time response. I think the whole world was wrestling with how do we get our minds around this, something new that we haven't seen before. Is it bloodborne? Is it airborne? Is it trying to wrapping our arms around in a very quick time.
Yes, it's
so important that you're connected to an industry that's talking amongst yourselves, like that ability to communicate cannot be undervalued. I mean, it is so important, and so I love the fact that you're talking and you're communicating, you're adding to and trying to identify kind of hot spots of where things might be a problem or not a problem. It's really, I don't think largely, I don't think most people can appreciate how much goes into that level of communication and on the front lines, really, of catching something new or identifying that there's a problem point here or there, and then making change about it. But you're doing that in real time every day.
Yes.
That's fascinating. Wow. Well, I'm one of the things that I'm very keenly aware is that with 30 centers and how many people do you think that you have under your care within all of your quality assurance measures? Just ballpark.
Oh, wow. I would say from a staffing standpoint, it's hard to be exact, but approximately 500 people.
Yeah, I was going to say maybe 300 or 400 people, but that's amazing. One of the things I know about anybody that leads that many people is that you have to have some real leadership qualities that are near and dear, and I've seen that in just our short time of getting to converse about these things. But is there anything that you'd like to encourage people with, just as far as like what it means to be a leader in your own right and to evaluate these high level decisions that you have to make with the passion that you have and the background that you have? Like what would you encourage somebody with that's just in real life, everyday life, going and saying like, it might feel like a very small task that you're doing in your daily life, but every one of those small tasks really lead up to something big. How do you encourage your staff? How do you encourage your people to really have the care that they do have over each one of those little tasks?
There are two main things that I try to ingrain, and it's what I've tried to follow. One is start with the why. Not to
Simon Sinek.
Yeah.
Yes, I love it.
Not to steal from another's work, but I'm a huge proponent of that when people understand the intent behind what it is they're doing, people are more passionate, people are more empowered, and people view it differently. It changes the mindset, and that's critical. And I think that's applicable to whether you're working in the industry, whether you're a donor in the industry, or whether you're a patient. So that's one standpoint. The other is to lead from the heart and to come from the heart on whatever you do. I myself I'm far from the smartest. I'm far from what I would consider an expert in the industry. I've of course done my best to serve the industry and to serve the patients. But at the end of the day, I try to go into it for the right reasons always, and always think about it. Whenever I'm making a decision, whenever I tell the team, whenever they're making a decision, do it from the heart. Think about the people who are receiving the product. Think about the people who are, donating to ensure that people have this product. To me, that's kind of the most critical thing. If you follow that, and if you do that in earnest, you'll make the right decisions and you'll do the right things. So that's kind of my main focus.
That's so good. That's so good, Maxwell. One of the things that we talk about a lot of times is that I think as leaders and as individuals, we make our decisions out of our values.
Yes.
And so caring for and being thoughtful about your own values is what really is that's the place that we all are going to make decisions from. And so if we can make sure that our values are right, a lot of times
yes,
the outcomes will reflect those values, and I think that that's so important. I love that you encourage people in that, because doing starting with why is a great book, by the way.
Yes, it is.
Fantastic book. And then, but also starting from that place of like, what is my motivation? But then finishing with like, I want to be intentional with my heart actions, because that is the place that you're gonna do things with the highest quality. And it makes a lot of sense. Your background, before you were at Kedron, I think you were at American Red Cross doing the same kind of thing for many years, and so I can tell that like your heart is in it, and that I think is one of the things that's been so wonderful for me as I've gotten to know you some. It's just been, knowing that the people who are on the front lines of making really our lives continue on. I'm fascinated really every day by the fact that, just it wasn't that long ago, quite honestly, like 60, 70 years ago, it was just not even possible for someone with hemophilia to even live. much beyond, maybe early teens, but today with the technology has advanced almost so rapidly that we not only see folks surviving, but we see people thriving.
Yes.
And that's largely because of the work that you and Kedrion and others have done to be able to stand on the front lines really of making sure that we have product and when the problems arise. This is what I always tell people in leadership, right? We're talking about leadership talks here. I tell people this all the time. It's like, the leader's job is never to make certain that everything goes perfectly. Matter of fact, that's a vain pursuit, right?
Yes.
But the leader's job is to make certain that when problems arise, that solutions are met. Yes. And that is and the faster that you can do that really is what lends to the skill of the leader, right? The faster in which you can execute that. And so, I know that in the 80s, there was a lot of trauma that was created, but there was a certain, to look at the pace at which it was solved was really remarkable. But then to go beyond that and to realize how many more things have occurred and that the response time has increased even better. And when we look at COVID, I mean, it could have been very similar story as what HIV was, but it wasn't. It was like a 2-year. I mean, that's really remarkable in the grand scheme of things. But the work that you're doing on the front lines of that is just, you're an unsung hero. And I just want to say from our community, thank you so much for what you're doing every single day for you and your team, because it's making a difference. Not only sustaining life, but it's giving us the confidence to know that we can still be here and really get to a place of thriving.
Thank you very much. And again, it's very humbling. And the one thing I will say in response to that is truly it's a team effort. That goes from the regulators. We partner. We view ourselves as a partner with the regulators, to every employee that works in this industry and in the biologics industry, and even with organizations and foundations like yours that are doing things to help educate and to help people kind of understand and bring light to these things and to these issues. So I see it that myself and Kedrion is kind of a cog in the wheel of the ecosystem that keeps this whole thing moving in the right direction. So thank you. But I truly feel it's a team effort.
That's awesome. Well, I appreciate you coming today and being a part of this podcast. And I really want to say that, if you are someone that has questions about maybe what we've talked about here today, you can always email us at info@hope-charities.org. If you'd like to get in touch with Maxwell and understand more about what they're doing, you can email us there too. We'll be sure to help you get in contact. But Maxwell, thank you so much for joining us for this conversation today. And thank you for being a part of all the things that we're doing to support patients every single day in our community. We couldn't do what we do if it wasn't for the support that you and Kedrion have provided to help us to get the message out. But thank you again so much for all that you're doing every single day, not just today, but thank you for all of it. We do appreciate you.
Thank you very much. Thank you for having me.
Thank you so much for joining us for the podcast. We'll see you soon.